Hello everyone, today we are going to learn methods oblique techniques of local anesthetic. There are several methods of local anesthetics. In that, first infiltration anesthesia, then second topical anesthesia, that is the surface anesthesia, then spinal anesthesia, epidural anesthesia. Okay, so first we will see about the infiltration anesthesia. So in infiltration anesthesia, we inject local anesthetic by subcutaneous route. For example, if this is the some part of the body, and some injury is occur. Okay, some injury is occur, and we want to suture this injury. So we can't inject needle directly into this place. Okay, we can't inject needle directly into this place. So first, what we do, we do here, or we inject here local anesthetic. Okay, so this type of anesthesia we call the infiltration anesthesia. Once again, I repeat here, local anesthetic injected by subcutaneous route. This is the some part of the body, and here is the some injury is occur, and we want to suture this injury. So we can't inject needle at this place. So first we give that patient or that individual first local anesthetic, and then we do minor operations or some surgeries. Okay, so but here one phenomena is there. We want local anesthetic only this part. We don't need to local anesthetic into the blood, because if local anesthetic goes into the blood, so via blood it goes to the heart, then it shows cardiotoxicity. Via blood it goes to the brain, then it shows neurotoxicity. So it local anesthetic we want only this place, not there is no need to local anesthetic into the blood. Okay, so that's why along with local anesthetic we give adrenaline, because adrenaline having the vasoconstrictor property. Vasoconstrictor, that is the adrenaline constrict the blood vessel. Okay, and local anesthetic remain only this place. Local anesthetic not goes to the blood, and it does not show cardiotoxicity or neurotoxicity because of the adrenaline. So along with local anesthetic give adrenaline to shows the longer effect of local anesthetic understood. Okay, then second type of anesthesia is the topical anesthesia, and we also call it a surface anesthesia. Next anesthesia is the topical anesthesia. So topical anesthesia, in this anesthesia local anesthetic placed on a mucous membrane. Okay, local anesthetic placed on a mucous membrane. So where is the mucous membrane is present? Mucous membrane present in nose, then mouth, then trachea, then bronchi, esophagus, and genital urinary tract. So topical anesthesia, in that local anesthetic only placed on a mucous membrane, and in that topical anesthesia we use drug cocaine. Okay, cocaine drug used, but cocaine having one property, that is there is no need to add adrenaline, because cocaine only one anesthetic having vasoconstrictor property. There is no need to add adrenaline along with the cocaine. So how to remember this? Initial letter of cocaine is the C, and also constriction is the initial letter is the C. So we easily remember that adrenaline, there is no need to add adrenaline along with cocaine, because cocaine also having a vasoconstrictor property, and if we add adrenaline along with cocaine, so there is a more vasoconstriction occur, and there is a complications like ischemia is occur. Okay, ischemia is occur. So once again I repeat the topical anesthesia. Topical anesthesia, in that case, local anesthetic placed on a mucous membrane. So mucous membrane present in a nose, mouth, trachea, bronchi, esophagus, and in that topical anesthesia we use drug cocaine. But cocaine having a vasoconstrictor property, so there is no need to add adrenaline along with cocaine. Yeah, and if we add adrenaline along with cocaine, so there is a more vasoconstriction occur and ischemia is occur. This is about the topical anesthesia. So in topical anesthesia, we use the Imla cream. Imla is the brand name of that cream. So Imla means the eutectic mixture. Okay, eutectic mixture, and it is applied on the intact surface skin. That is the surface anesthesia. So why eutectic mixture is used? What is the purpose behind this? So suppose this is the skin layer, okay, and above the skin we know that there is a keratinized layer. So there is a if we apply local anesthetic, so there is a less penetration due to the keratinized layer. So if we use eutectic mixture, so there is a easily penetration is occur, and the keratinized layer is very thick to produce anesthesia. That's why eutectic mixture is used, and eutectic mixture easily penetrate and produce anesthesia. Okay, eutectic mixture is used because the eutectic mixture is easily penetrate into the skin and produce the anesthesia. So what is the composition of eutectic mixture? So eutectic mixture is the composition of two anesthesia. Okay, in that first is the lignocaine to 2.5% and prilocaine 2.5%. Eutectic mixture is what mixture, that is the two substance or two ingredient. First one is the lignocaine and second one is the prilocaine, both anesthesia. Lignocaine is also local anesthetic drug and the prilocaine is also local anesthetic, and combination of both these is the eutectic mixture, and eutectic mixture easily penetrate the keratinized layer and produce the anesthesia. Next, then third one is the local infiltration. In this method we inject local anesthetic into the extravascular placement, that is the tissue. Okay, and example is the lignocaine, bupivacaine and ropivacaine. And in this type of anesthesia, along with local anesthetic, there is need to add vasoconstrictor property drug like adrenaline also we call epinephrine. So local infiltration, in that drug injected into the extravascular placement, that is the tissue, and drug used are lignocaine, bupivacaine, ropivacaine. And along with local anesthetic there is need to add adrenaline, because adrenaline having the vasoconstrictor property, because we want effect of local anesthetic into only that place. There is no need to goes local anesthetic into the blood, because if local anesthetic goes into the blood, so via blood it goes into the brain and heart and it shows some complication. So along with local anesthetic there is need to add adrenaline. Then third one is the peripheral nerve block anesthesia. Peripheral nerve block anesthesia, in that local anesthetic inject into the peripheral nerve. Peripheral nerve also we call nerve plexus. Nerve plexus means the nerve branching. Okay, so here is the I will show you diagrammatically. Suppose this is the nerve, okay, and this is the nerve plexus or nerve branches. So here we inject local anesthetic, or here we give local anesthetic, because what is the functions of nerve? Suppose this is the one nerve and this is the second nerve. So nerve communicate information from one nerve to another nerve, and nerve communicate information about the pain, temperature, pressure. So if we block the nerve plexus, okay, so information cannot go to the one nerve to the another nerve. Okay, then next one is the intravenous regional anesthesia. In this method, we inject local anesthetic by IV route into the limbs, okay, and in that upper limbs, that is the arms, and lower limb, that is the hip. And in that method, we use the local anesthetic drugs like lignocaine and prilocaine, because it is the safe local anesthetic. But it is but in this anesthesia, or in this method, bupivacaine is the contraindicated drug. Next method is the epidural anesthesia. Epidural anesthesia, in that we inject local anesthetic into the epidural space. Epidural space means the space, that is the area between the dura mater and the vertebral wall. And in between two, that is the dura mater and the vertebral wall, there is some fat and some blood vessels are present, and in that area, or in this area, we inject the local anesthetic. Example: bupivacaine, ropivacaine, and leopovicaine. That is the example of epidural anesthesia. Then next one is the spinal anesthesia. According to name, spinal anesthesia, that is the we inject local anesthetic into the subarachnoid space. Subarachnoid space, that is the cerebrospinal fluid space. An example is the chlorprocaine. This is about the method oblique techniques of local anesthetic. Once again, we will repeat these all the methods and technique. First, we learned about the infiltration anesthesia. In infiltration anesthesia, we inject local anesthetic by subcutaneous route, and along with local anesthetic, we give one adrenaline, because we want action of local anesthetic only locally, okay. Then second one is the topical anesthesia. Topical anesthesia means surface anesthesia. In this anesthesia, local anesthetic placed on a mucous membrane, and the mucous membrane is present in the nose, then mouth, then trachea, then bronchi, then esophagus, okay. And the drug used in this topical anesthesia is cocaine, but this is the only one drug, that is the cocaine. Along with cocaine, there is no need to add adrenaline, because cocaine also having the vasoconstrictor property, and if we add cocaine and adrenaline, so there is a more vasoconstriction is occur, and due to more vasoconstriction, there is a ischemia is occur. So this is the only one drug, that is the cocaine. Along with cocaine, there is no need to adrenaline, okay. Then in this topical anesthesia, we use the Imla cream. Imla is the brand name of that cream. Imla, that is the eutectic mixture. Eutectic mixture applied on the intact surface skin, okay. Intact surface, that is the no broken surface skin, intact surface skin, okay. And why eutectic mixture is used? Because the layer of skin having the layer of keratin, and due to keratin layer is the very thick layer, and due to thick layer, local anesthetic less penetrate into the skin. So if eutectic mixture is used, then local anesthetic easily penetrate and the produce anesthesia. And the eutectic mixture is the mixture of lignocaine and the prilocaine. Lignocaine and the prilocaine 2.5%, okay. Then we learned about the local infiltration. Local infiltration, in that the local anesthetic give into the extravascular placement, that is the tissue. And the example of the local infiltration, lignocaine, bupivacaine, ropivacaine. And in this method, in this method we add adrenaline along with the local anesthetic. Then as per name indication, next method is the peripheral nerve block. Peripheral nerve block, because we know that the function of nerve is the communicate information, okay. Communicate information one nerve to another nerve. And if this is the nerve, and this is the nerve plexus or nerve branches, so if we inject local anesthetic at this place, so this nerve plexus, it does not communicate information to the another nerve, okay. So there is a nerve block. Okay, there is a blockage of nerve. Okay, and look, and anesthesia is produced. Then the next one is the intravenous regional anesthesia. Intravenous regional anesthesia, in this we give local anesthetic, or we inject local anesthetic by IV route into the limbs. In that upper limb, that is the arms, and the lower limb, that is the hip, etc. Okay, and in this method we use the lignocaine and prilocaine, because it is the safe intravenous, as per name indication, IV, intravenous regional anesthesia. Okay, that is the, in this method we inject local anesthetic by IV route, IV. Okay, and the bupivacaine is contraindicated in this method. Next method is the epidural anesthesia. Epidural anesthesia means the epidural, that is the epidural space. So what is meant by epidural space? Epidural space means the area between the dura mater and the vertebral wall, and in between these there is fat, and also small blood vessels are present. Okay, and in this space we give local anesthetic. Next method is the spinal anesthesia. Spinal anesthesia, that is the, we inject local anesthetic into the subarachnoid space. Subarachnoid space, that is the cerebrospinal fluid space, and example of this is the chlorprocaine. This is about the method and techniques of local anesthetic. Thank you.